Well, welcome back to Cape Town. This is the last day of the 17th conference on tobacco or health. It's been happening for the past 3 days, and I must say, when I spoke to the president of the conference a little bit earlier, she said the exciting thing about this conference is that there's almost this renewed commitment on a global level in terms of dealing with tobacco control. But to tell us more about the South African perspective now is Lorato Mahura, who is from the National Department of Health. Thank you so much for joining us this morning. You know, the minister made a lot of commitments at the start of this conference, and one of them was the amendment of the Tobacco Act in South Africa. What's happening there?
Morning, Nomawethu. We actually looking at 4 areas in terms of the legislation amendment. We're looking at the electronic devices. We're looking at the 100% smoke-free areas in public indoor places, as well as certain outdoor areas. We're also looking at the point of display. We're also looking point of sale display. We're also looking at graphic health warnings and plain packaging. So it's not a lot for this round. There's more that can be done in terms of controlling tobacco in South Africa. But the 4 key areas are very, very urgent, because over the years what we have realized is that legislation is helping us to reduce the supply and the demand of tobacco products in South Africa. But we are not saying the treaty doesn't guide us to use other measures as well. There are many measures that we could be using. I would also like to point out that what we have realized, we used to be the sort of the front runners in tobacco control, in a sense that long before the treaty came into play, we already had the Tobacco Products Control Act. Then what happened later is we amended it 3 times already, and there was a lag in terms of not doing much about it. But out of the act, we were able to develop about 4 regulations. And if you look at the dates in which they were developed, it's already around 2000, which is way long ago. We are now in 2018, and 2000 is a long time ago.
I just want to interject there, ma'am. You talk about, you know, we used to be the front runners and we've lagged behind. Do we have any sort of time frames with the recent announcement about this amendment by the minister? Are there time frames there?
What the minister was saying is that we are ready to hit cabinet. The bill is ready. It's a proposed bill, and it's ready now to be tabled in cabinet. Now, people are asking, when will it be promulgated? When will it be put into force? We don't have answers. As soon as it hits cabinet, decision-making procedures now are guided by the cabinet. It's not the department that takes the responsibility of that. But we are sure that because we've been continuously sort of consulting other stakeholders that have interest in the bill and that do not have interest in what we're talking about, those pro and those against tobacco control, the consultations will continue even when the processes are running in cabinet. We won't stop them. So and the other key questions that the public is asking, explain to us exactly what is it that you want to change.
And tell us about those changes.
Our concern with the electronic devices, like your e-cigarettes, is that people are using them everywhere, and they know no age restriction. You know, they can be accessed by people that are under 18 and people that are over 18. They have nicotine, which is addictive. They have vapors or some emissions that are also not good for people that are not using the e-cigarettes, people that are sort of standbys. And we saying, because it has nicotine content and other ingredients that are harmful, it should also be controlled. We shouldn't like having people smoking or vaping it everywhere. And then with regard to the graphic health warnings, if you look at our cigarette packets, they have text messages to warn people about the use of tobacco. They do not have pictures at this point in time. So all that we're saying is that put pictures on it so that people can know that it's not good to use tobacco products. We also have at the supermarkets your point of sale displays. they are luring our young people, especially our young people, to use cigarettes, to demand the cigarette, and they put them next to sweets and all that. We don't like that kind of promotion and advertising. They also use packaging to sort of lure the youth, especially because young elderly people know the difference in most cases. They also use that to get our people to use the products, and we are saying it has to come to a stop.
Well, thank you very much for your time. That there was Lorato Mahura. She is from the National Health Department, talking to us more about some commitments that were made by the Health Minister at the start of this conference, such as the amending of the Tobacco Act in South Africa. They say they can't really give us answers in terms of time frames about when we're likely to see changes at this point, but there's definitely a commitment in South Africa to deal more about tobacco control. I mean, we've seen this in restaurants, we've seen it in hotels. There's definitely been some changes, but we certainly need to do more. With that, it's back to you in the studio.